More than 6 months into quarantine, the Philippines is still struggling to control the coronavirus pandemic. As of September 25, the country has the worst COVID-19 outbreak in Southeast Asia. While President Rodrigo Duterte is still waiting for a vaccine from China and Russia, Filipinos have to abide by the rules.
Ito natin na pag di ho kayo sumunod sa social distancing, pwede ho kayo makasuhan yan.
But instead of clear-cut policies, the government leaves citizens even more confused with rule changes and contradictions in its pandemic response. On September 7, the Interagency Task Force approves the Department of Transportation's proposal to ease physical distancing rules among commuters. But why? Reducing physical distancing rules in public transportation will increase the passenger load. Economic leaders believe this will help resuscitate the economy. But at the expense of whom? Former COVID-19 Task Force Advisor Dr. Tony Lechon says the IATF will be, quote, perpetuating a huge error, and they will be accountable for lost lives of Filipinos, unquote, if they will not reverse the new guidelines. He also calls this move reckless and risky. Both secretaries of the Department of Health and the Department of Interior and Local Government agree. The 1 meter distance rule should be non-negotiable. Amid the uproar, DOTR Secretary Arthur Tugade, on September 17, suspends his own physical distancing rule less than a week after its implementation. On September 19, Presidential spokesperson Harry Roque says Duterte has finally decided to maintain the 1 meter physical distancing rule. Speaking of physical distancing, remember when more than 8,000 locally stranded individuals, or LSIs, were crammed at the Rizal Stadium in July? This was the Hatid Tulum program of the government. It aimed to assist LSIs in Metro Manila get back to their provinces by giving them a free ride home. This is similar to a pet project of Senator Bongo called Balik Probinsya Program, a long-term scheme to decongest Metro Manila by facilitating the transfer of migrants back to their provinces for good. But in May, 2 returning Leyte residents under the Balik Probinsya program test positive for COVID-19, bringing the infection to their once virus-free towns. The program is temporarily suspended in June to prioritize LSIs under the Hatid Tulong program. This further helps spread the virus to some provinces. Although all LSIs undergo a rapid test before they are allowed to travel home, a family of 3 stranded in the Rizal Stadium test positive for COVID-19 when swab tested upon arrival in Negros Occidental. This begs the question, if a rapid test is inaccurate, why is it still being used in coronavirus testing? In March, the DOH doesn't recommend the use of rapid test kits because these can produce false negative results. In short, rapid tests can be inaccurate. Despite this, in April, Duterte orders the procurement of 3.3 billion pesos worth of rapid antibody test kits to increase the country's testing capacity. In May, medical groups warn local government units and employers the rapid test kits are a waste of resources.
Kailangan maging maliwanag sa atin mga mayors na yung rapid test hindi yan ginagamit for diagnostic para malaman natin kung sino talaga meron. PCR pa rin kasi madodoble lang tayo kung lahat ng mga magagawa babalik sa mga businesses nila, mga trabaho nila at ititest natin ng rapid, yung mga positive i-require na naman natin ng PCR, doble gastos, di ba? So, sayang ang resources.
Duterte's economic advisor defends the use of rapid test kits.
Kasi yung problema ng itong mga doktor, salita ng salita, wala naman ginagawa, complain ng complain. Ang mangyayari dito, kung magsisarado uli yung ekonomiya ng Pilipinas, maraming mawawala ng trabaho.
In August, a group of doctors point out that the massive use of rapid test kits may have been the cause of COVID-19 spread in workplaces.
Na hindi siya magandang tool para malaman kung sino ba yung dapat nang pumasok sa workplace. Kasi parang one time, big time nangyayari. Pag negative ka doon, biglang pinapayagan na.
Doctors maintain that the swab test is still the gold standard for COVID-19 testing, which is 97% accurate. The downsides? The results may take 1 to 3 days to process. it can be a little pricey. One swab test in a private hospital costs around 3,000 to 8,000 pesos, beyond the reach of ordinary Filipinos. Should Filipinos pay for an expensive swab test to get an accurate result? Or should they settle for a dubious diagnosis for a much cheaper price? Public health experts say the government must set the standard for accurate tests. After all, thousands of lives are at stake. On September 8, DILG Secretary Eduardo Año suggests banning home quarantine for COVID-19 patients. He says the government will strictly implement this policy once approved by the President. This, despite the lack of isolation facilities and hospitals in the country. Every day, the number of new COVID-19 patients pile up by the thousands, pushing most hospitals to full capacity. But the Department of Health stand is different. DOH says home quarantine is encouraged if the patient is asymptomatic and meets the requirements. The agency says home quarantine needs to be considered as the government builds more treatment facilities. On September 24, Harry Roque announces that persons with asymptomatic and mild cases of COVID-19 will be required to isolate in government-approved facilities, giving a green light to the home quarantine ban. The Education Department also adds to the confusion. Amid calls to delay classes, Education Secretary Leonor Briones wants to push through with the opening of classes on August 24.
Hindi kami nagbabago sa aming stand, Mr. President, na maximum August 24 talaga kasi yung sa batas last day of August is on a weekend. So August 24 magbubukas na ng klase, whatever form it is.
She even proposes to allow face-to-face classes in low-risk areas. Despite the risk, the DOH supports Briones' proposal. In May, Duterte rejects DepEd's proposal to open schools in August.
I will not allow the opening of classes na magdikit-dikit yung mga bata. Na wala ng aral. Laro na lang. Unless I am sure that they are really safe.
10 days before August 24, Briones decides to move the opening of classes to October 5 instead.
There will be no face-to-face sessions. And sessions will not be limited to online sessions alone.
With these conflicting policies and flip-flops, citizens are left asking, ano ba talaga?